Hi, and welcome to my presentation about the ACL TAR, injury and rehabilitation. My name is Batul, and I will explain in my today presentation about the ACL TAR, causes, symptoms, and treatment. Basically, the ACL is the anterior cruciate ligament. It's a ligament that runs diagonally in the middle of the knee. It prevents the tibia from sliding out in front of the femur and provides rotational stability to the knee. So the aim from my presentation is to talk about the pathology of injury, the clinical presentation of ACL injury, problem after ACL injury, videos of exercise of early stages of rehab is including in my presentation, and some outcomes of rehab plan. So I have a patient aged 22 years old. She's a female footballer. She ruptured her left anterior cruciate ligament while playing about 4 weeks ago. The ACL was torn when she was planted their foot into the ground with their leg facing away from their knee. That can cause the leg to twist. This means that the player has transferred her weight, which twists her hip, causing a significant torque at the knee joint. That called the knee valgus tendonitis. So this could be happen because of the player may have muscles, weak muscles, or unsuitable type of training. And it's usually more common to occur at female than male footballer due to the anatomical differences or some hormonal differences according to some study. So the ACL, as I explained, it's a primary stabilizer for resisting anterior translation of the femur on tibia and control hyperextension of the knee. It's a secondary stabilizer of internal and external rotation as well as varus and valgus stress. And as I explained, it's injured mainly through a valgus force applied to a flexed laterally rotate knee with foot planted on hyperextension with medial rotation as it's shown on the picture on the side. So the clinical presentation, I have done my subjective and objective assessment, and the subjective assessment show that the mechanism of the injury is usually landing and twisting injuries. I have heard some popping sounds, and the patient was complained from severe pain. She was unable to wait back or continue some activity, little bit swelling, stay and instability while turning. From my objective assessment, it was very clear that my patient got restricted range of motion, particularly in extension. Active range of motion, passive range of motion have done with for resistant muscle and test and resistant muscle test with some neurological screen to clear everything. Everything else was clear. I got positive Fleischmann test and positive anterior jogger test, positive Lili sign, and the rest was negative. X-ray might be asked to uh, to define more diagnosis. So it can be a partially tear or complete tear. In case the ACL is completely torn, the patient needs a surgery to be fixed. And in my case study, actually, the patient has a partially tear grade 2 that require a complete rehab plan to recover. So the differential diagnosis, after doing my special test, the patient experienced empty and soft ankle, laxity, anterior translation of the tibia from the femur in the injured leg comparing with the uninjured one, and according to Benjamin et al. 2006 meta-analysis that said that the specificity of this test can be around 92 and the specificity around 91%. So according to the assessment findings, patients are most likely to have an ACL rupture grade 2. MRI can support the finding. So treatment for ACL injury after 4 weeks. Once the swelling subsides, after using the cryotherapy, the patient must start a rehab plan. I have educated my patient about the injury and recommended her doing some exercises. Warm up 5 to 10 minutes on the bike before we start the exercise session. And I have choose half squat, heel raises, single leg extension, and also some stretches after doing the exercise. So why isometric, concentric, and eccentric are allowed at early stages of rehab? Because we will prevent putting any load on the tissue that can cause more damage. So the exercise aim at early stage is to regaining normal joint range of motion by reach full extension. So let's see with each other how to perform the exercise and how to coach it.
So I will ask my patient to do the half squat, and this can be performed by put both hands into the chair, feet and part from the shoulder, and then all what I want at my patient just flick the knee up to 60 degrees and hold it for 10 seconds for 10 repetition. So I ask my patient to perform the exercise for me, which is the half squat. So all I need you to put your hand into the table and place your feet apart with your shoulder, and then slightly bend your knee, hip down for 60 degrees, hold it for 10 seconds, and we will repeat that for 10 times.
Hold it for 10 seconds. No, okay, Karen scored and said, okay, we're going to hold it for 10 seconds. Okay. You're going to count to 10.
1, 2, okay, and then again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I will perform for my patient now a single raise extension exercise. All I need to rub this back around the feet and then slowly extend my feet to 180 degrees. Hold it for 10 seconds and then relax. I will repeat it for 10 times. So you will perform the single leg extension. All what I need you to put the band around your feet and then hold it, extend your feet up to 90 degrees, hold it for 10 seconds, 1, 2, 3, 4, 5, 7, 8, 9, 10, and then relax, and you will repeat this 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. So I will perform for my patient the heel raises. A hand on the chair or a stable place. Then on what I need that my patient slightly bend the knee into flexion, 20 degrees, and then raise the other foot onto the tiptoe. Hold it for 5 seconds and then lower it down. So I will ask my patient now to perform the heel raise exercise. All what I need you to put your hand into the chair to balance, and then slightly bend your knee up to 20 degrees. Then raise your other leg. Raise it up. Yeah. On your tiptoe. Hold it for 5 seconds. 1, 2, 3, 4, 5, and then slow down, go down. This is repeated for 10 times. 1, 2, 3, 4, 5, down. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Done.
So as a result of completing the rehab stage, the patient had to gain full range of motion of the knee, repair muscles strength and proprioception, gain good functional stability, reach the best possible functional level as walking, running, or jumping, and decrease the risk of re-injury and return to sport. After doing the rehab exercises, my patient had a significant difference in increased range of motion, decreased pain that measured in VAS scale 6 out of 10, and increase in knee extension. The patient was able to walk and balance again. It's really important to avoid exercise that compress or put weight on the knee. Instead, the focus should be on strengthening the muscles surrounding the knee and some ACL rehab exercises uh, should must be avoided in some cases that we don't get a failure of our plan. So to have a successful plan, we should avoid excessive weight bearing before the body is ready, at early in the recovery process, perhaps immediately after surgery or after injury. Walking without support too early can cause failure, and full range open chain knee extension can also be so. As a summary, an ACL injury happens when the person overstretch or tear the ACL ligament in the knee, and it might need a surgery or extensive rehabilitation to recovery from this injury. Exercises can be done at home or at a clinic as we done in our presentation, helping the patient uh, to recover faster. And always we have to start with the safest exercise and avoid compression or putting weight on the uninjured knee, as well as avoiding the rehab exercises that can be uh, causing more damage for the tissue instead for healing to get or reach a successful rehab plan. Finally, I have added some references that support my finding and my diagnosis and my treatment.
Repeat it for 7 times. Done. Cut.
Reach normal walking gait, regain quads and hamstring muscles activation, and decrease pain, and some neuromuscular training and balance. So my outcomes shown that increased range of motion, decreased pain measured in a VAS scale to 6 out of 10, increase in knee extension, and the patient is able to walk and balance. So as a summary, an ACL injury happens when the player overstretch the ACL ligament in the knee, and it might need a surgery or extensive rehabilitation to recover from this injury. Exercise can do at home or at clinic can help the patient while waiting for the surgery or work on the rehabilitation. We have to always start with the safest exercises and avoid compressing or putting weight on the uninjured knee. And basically here I got some references that can support my finding and treatment.